The Parliamentary Health Committee started their monitoring at Luweero Hospital in Luweero District to ascertain their working environment. In their findings, National Medical Store has spent 2 quarters without supplying drugs to the district main hospital, which strongly affects the rest of the health facilities in the district. The District Health Officer Innocent Nkonwa, in his report presented to the committee, strongly pointed out a number of challenges such as inadequate housing facilities for health workers, shortage of drugs, and receipt of inappropriate medicine by the national medical stores.
Is that every time the essential medicine that supplies are not available, they create a loophole for people to extort money. Because if someone comes and there is no supply, they tell you the supplies are not there, but for my bag, my bag. For my thing that if we can cover the NMS equation and we address some of those issues, it will help us to address the issues of extortion because of the gaps which NMS is bringing in some of our facilities.
Brenda Nabukenya, the Luweero District Woman Member of Parliament, raised concern over the dilapidated state of the General District Hospital, citing out inadequate space for the patients.
So many things that have not yet been achieved, even the status of the infrastructure in this General Hospital, because this is the district hospital. You realize that most of the wards are dilapidated and there is no enough bed space. Especially in the maternity ward, where you need enough space, you need good, clean, environment for the safety of the mothers and also the newborn. You realize that the maternity ward is not enough. The post-maternity ward is not also enough. It's like that they don't have enough beds. So they end up discharging mothers who should be watched for almost 24 hours.
Dr. Charles Ayume, the Chairperson, Parliamentary Health Committee, has urged government to put more emphasis and prioritize Luweero Hospital because it accommodates a number of patients stretching from Chiriandongo to Kayunga.
So it's of utmost interest. It's a highway facility. We have to give it a special attention. And there's been work in progress for the last 10 years to try and see that this hospital is brought up to the right standard. But every financial year money is appropriated, and it has taken us 10 years to finish a hospital. So as a committee, one of the issues we have picked is that we need to finish this 5-story block, which is going to house the inpatients, it's going to house the emergency, it's going to house the 2 theaters.
Ayume further condemned the operations of the national medical stores for their delayed actions and supply of inappropriate drugs to the facilities and called upon government for quick intervention towards checking their operations.
I think the issue of NMS is a countrywide thing. We have seen it in Mpigi, where we were yesterday. And I think we'll have to have a very candid discussion with the national medical stores, because we cannot have facilities for 4 months, for 5 months, skipped cycles. It creates a very bad impression, government, and yet on our side we appropriate this money for procurement of medicines. But at the same time is the outcome of inefficient delivery of drugs is death.
According to the District Health Officer of Luweero District, Innocent Nkonwa, inconsistent supply of drugs by national medical stores in health facilities, especially those based in rural areas, is one of the triggers of corruption in terms of selling drugs to patients. This is Church of Uganda Family TV.